taking a detailed history, I move into patient education. Our patients are capable of understanding complex physiology. We need to teach it to them. So here I am to teach it to you. We need to teach them the physiology of insulin resistance. Insulin resistance is the root cause of type 2 diabetes. First, I start by teaching them the normal physiology of insulin. The pancreas is a little organ that sits in the middle of your abdomen, and one of its many responsibilities is secreting insulin, which is a hormone that helps modulate blood sugar by preventing it from getting too high. The pancreas works in two ways. It sputters all day long, secreting basal insulin. This is to counter sugar that is constantly being produced by the liver all day and all night because our brains, our hearts, our lungs need sugar for energy. So the liver is constantly producing sugar and the pancreas is secreting insulin all day and all night to make sure that that sugar doesn't get too high. Now, at meal times, most of us ingest carbohydrates. This causes our blood sugar to peak. Thus, the pancreas secretes a little burst of insulin or bolus insulin at meal times to prevent our blood sugar from getting too high. Now, as we develop prediabetes or type 2 diabetes, our bodies become insulin resistant. Our pancreas is working hard to produce insulin, but our body no longer knows how to use it. And that is due to everybody's favorite three-letter word, fat. Fat causes insulin resistance, and this can be body fat or fat that we wear, or dietary fat, fat that we can eat. Dietary fat can actually acutely worsen insulin resistance. So how does this work? Well, imagine the bloodstream next to the cells, for example, the muscle cells. When the blood sugar gets high in the bloodstream, normally insulin goes and opens a gate, lets that sugar into the cells. The muscles use that sugar as energy, and all is well in the world. When we start to have excessive fat, though, that fat impairs that signaling. The fat goes and mucks up that gate. So the sugar goes high, insulin starts yelling at the gate to open up, but the gate is stuck due to excessive fat. So the insulin levels go higher also, but the gate's not opening, so the sugar goes higher and the insulin level goes higher as well. And while insulin is a wonderful hormone, we need it to live. At high levels, it causes more weight gain and fat deposition, thus worsening insulin resistance. So we end up in a vicious cycle of high sugar, high insulin, worsening insulin resistance, more weight gain that finally spirals into prediabetes and eventually type 2 diabetes. Now, remember the liver that we talked about? Well, the liver becomes insulin resistant as well. For example, under normal circumstances, when we eat a cupcake, insulin goes to the liver and says, "Hey liver, stop making sugar, we got it for free from somewhere else." Now, when we become insulin resistant, the liver gets filled with fat and that signaling gets impaired. So we eat the cupcake and insulin says, "Hey liver, stop making so much sugar, we already have it," but the liver is not listening. So the liver continues to produce sugar willy-nilly, so we have another vicious cycle of high sugar, insulin screaming at the liver to stop, so high insulin levels lead to more weight gain, thus worsening the insulin resistance, and we have type 2 diabetes developing because of insulin resistance at the liver as well. So we have two vicious cycles of insulin resistance going on that eventually land us in type 2 diabetes.
To review, ensuring that our patients thoroughly understand the pathophysiology of insulin resistance is key to enabling them to get to their best diabetes health. Insulin resistance is the main cause of type 2 diabetes. Insulin resistance is primarily caused by fat, both dietary fat that we eat and body fat that we wear. Saturated fat is associated with more insulin resistance than polyunsaturated and monounsaturated fat. Insulin resistance causes sugar to get stuck in the bloodstream because insulin-mediated signaling for uptake of blood sugar becomes impaired. The sugar gets stuck in the bloodstream. Insulin resistance leads to high insulin levels, which leads to weight gain and furthers insulin resistance, further high sugars, and this is a vicious cycle we need to break.